In a remarkable response to the challenges of the pandemic, the Mental Health and Substance Use Access and Flow Physician and Operation Leads team has redefined resource allocation, making mental health services more accessible across the region and province. At the heart of their efforts lies an unwavering commitment to streamline patient care processes by building strong partnerships.
The collaboration that the physicians have brought has developed pathways and has allowed operations then to move forward smoothly because of the partnership of physicians, and that is a unique feature of this work.
I'm proud that we have a reputation for standing beside our partners now. I think that there was a time when some of our external partners felt like it was an us versus them scenario. And now they don't hesitate to pick up the phone if they want us there beside them in creating solutions or navigating systems with them. This team has incredible qualities of leadership throughout, across the physician leadership as well as the operational leadership. I think that they are responsive, they're accountable, they really care and continue to keep the client at the center of things. I know that that can be, a statement easily thrown around, but I know that the people in this leadership team take this personally, they take it seriously. They haven't forgotten why they took a seat at the table, why they became a physician leader, why they became a healthcare leader. They continue to show up and demonstrate that every day in order to get the job done and to continue to advance our cause.
Congratulations to the Mental Health and Substance Use Access and Flow Physician and Operation Leads team, recipients of the Best Collaboration Award. Recognizing the need for change, in January 2021, the Royal Columbian Hospital Sling Management Shared Work Team was created to provide quick, sustainable solutions to supplying essential equipment for point-of-care teams. The multidisciplinary effort featured members from diverse fields, ranging from ergonomic services to the linen department, all sharing the common goal of improved patient care and site sustainability.
We were trying to solve a sling access issue. Staff had been coming to me saying that they didn't have enough slings to follow best practice with patient handling, and so this group was formed to try to address that issue.
We always knew that one of the solutions is to purchase more slings, but obviously that wasn't enough. So we also look at the process, we look at how we actually use the sling, how do we retrieve it, how do we return it, and we figure out a different way of laundering our slings so that it gets shorter turnaround time. After we created a streamlined process, we educated the process to the staff. We formed a site equipment committee to monitor the use of it. We got a designated person to take care of the slings and do the regular audits and staff survey to be proactive, to identify the number of slings that we have at the point of care. So we just got like a full, comprehensive solution to look at it being sustainable.
The importance of a sling is that staff will be able to mobilize patients earlier, safer. Patients will be able to get in and out of bed easier. Access to this small piece of equipment has the ability to help so many people, staff, patients. It also helps with, health and safety initiatives with preventing injuries to staff.
We want to get the patients moving and out of bed, but many times they can't do it themselves. And the help that they need is more than the staff are able to give physically. And so by using those slings, we are able to get patients up and out of bed and sitting upright. And that does help with their recovery. And they are out of the hospital faster.
I like dreaming big. And I think anytime I have an opportunity that I get to work on a challenge and try to find a solution, I think that's very satisfying. I think what dawned on me is that innovation can be just using the same thing but in a different setting.
I think what's so exciting about this work is that this is the first that it's been done in Fraser Health and also outside of the health authority. There are so many people asking me how we achieved this and wanting to follow or replicate this model.
So I'm just so excited that the team did not give up. They just kind of got together, and they also spent that time to look into the issue, really study the issue and come up with the solutions.
Congratulations to the Royal Columbian Hospital Sling Management Shared Work Team, a recipient of this year's Best Collaboration Award. Formally established in 2020, Fraser Health's long-term care and assisted living physician leadership team were united by a common mission to enhance the lives of our community's most vulnerable residents and their families. Harboring a diverse wealth of experience, the team worked to actively foster collaboration and innovation among internal and external stakeholders to improve the lives of seniors in long-term care.
The long-term care and assisted physician leadership was formed for several reasons. The most important one was to make sure that the physicians were involved in charting out the vision of what long-term care and assisted living needs to be in British Columbia.
Before the long-term care and assisted living team came together, some of the big challenges were about helping our local physicians and medical directors find the support they needed across all their communities.
This team has shown extreme resilience through the pandemic, and not only going through the everyday motion, but always considering how can we do things better.
The team is amazing, led by a really inspirational and thought-provoking leader who likes to challenge the status quo, so I really like working under Dr. Mithani. And then the group he's brought together is just really good, smart, passionate physicians who want to make change.
The best thing about working with this team is really to collaborate with all the other physicians and team members that have the same visionary thoughts about how to support seniors.
They have a lot of ideas, but their ideas are extremely innovative, and I think they're going to position us to be a leader in the province and across Canada in long-term care and assisted living.
They inspire me because they look at how they care for the elderly and changing that sort of pre-existing mindset of that, well, we'll just make them comfortable. It's like, how can they have more quality of life?
This team is truly motivated. Their expertise is very diverse.
The successes I've seen really are around that when there is a crisis, when there is a need in all the communities, we have people ready to strike and do that and help out.
Every day want to do better for my patients, help them navigate the system, feel better, know their body, be proud of their body, whatever it is.
Making a difference, or at least trying to make a difference, and improving patient care in a more administrative way in the back end.
We're on the horizon now to do things that has never been done in long-term care.
In the last year that I've been in this role with this team, I have witnessed them make some transformational change and think outside of the box.
I love being in leadership, and mostly because I have a chance to support others, mentoring other people in their day-to-day work. And when you're able to support somebody else who then supports a whole other group of people, it lets me reach so many lives and support so many people all at once.
Caring for our elders in long-term care homes is a satisfying addition to anyone's career, not only for the help that you can provide, but for the intellectual stimulation that's necessary to provide excellence in care.
We want to be the international leaders, in long-term care and assisted living, right? And I think that this team and the profile of this team, the expertise of this team, the passion of this team, the commitment of this team, it's going to make this team realize that dream.
Congratulations to the Long-Term Care and Assisted Living Physician Leadership Team, recipient of this year's Best Collaboration Award.